I'm board-certified New York City plastic surgeon Dr. Darren Smith, and this is Plastic Surgery Before and After, your source for the real deal about plastic surgery procedures, news about trends in aesthetic medicine, and candid sessions with industry insiders. We hope you enjoy today's episode. What is AccuTite? AccuTite is a minimally invasive radiofrequency-based treatment that tightens skin. And what makes AccuTite so special is that the device is so small that you don't need any true incisions to use it, and it can be used in very small, sensitive areas. Specifically on the face, AccuTite is very effective for tightening the upper and lower eyelids. It's great for tightening the midface and reducing the prominence of nasolabial folds. And it's also a great way to treat early jowls or sagging soft tissue along the jawline. How does AccuTite work? Well, AccuTite is a bipolar radiofrequency device that fires radiofrequency energy between two prongs across the skin to heat the skin and induce shrinkage. Essentially, it's causing a controlled injury, and as that injury heals over 2 to 3 months after the treatment, the skin contracts and shrinks. So how does AccuTite work without any real incisions? So we actually use a needle, an 18-gauge needle, to make a puncture in the skin, and the smaller AccuTite probe actually fits through this needle puncture. And this smaller probe goes under the skin, while a slightly larger probe goes over the skin. And the device shoots radiofrequency energy between these two probes, or poles, and this heats the skin in a very precisely controlled way. What's the difference between FaceTite and AccuTite? It's essentially the same technology, and it's made by the same manufacturer. But the AccuTite device is much smaller than the FaceTite device. So for example, where we might use the FaceTite device to tighten skin of larger areas like an entire neck, we would use AccuTite to focus on these smaller, more delicate areas like I mentioned above in the face and some body areas as well. AccuTite is great for tightening the skin under the armpits that sometimes falls over a bra or bathing suit. It can also be really good for loose skin around the knees. One of the key differentiating factors between AccuTite and FaceTite is that FaceTite generally does require a small incision to get the probe under the skin. But since the AccuTite probe is so small, we can effectively get the probe under the skin by just using a needle. And these needle punctures really heal without any visible scar. How long does it take to recover from AccuTite? The truth is that you'll probably feel like you can go back to work almost immediately after the AccuTite procedure. However, you will be quite swollen, and this is in large part from the numbing medicine that's used with AccuTite. And this is something that in some cases will be very similar to the tumescent fluid that's used with liposuction, and that's something that we've discussed in earlier episodes. So while you might feel up to going to work right away, since this is a procedure that's often performed under straight local anesthesia, you will have some social downtime. You won't feel like you look up to going out and about. So I generally recommend 5 to 7 days away from any professional or social obligations after the AccuTite procedure. What is the cost of AccuTite? This is something that will vary significantly from practice to practice and from geographical area to geographical area. But in general, a reasonable expectation is that an AccuTite treatment of a given anatomical area will cost somewhere between $2,000 and $4,000 depending on the size of the area being treated and the expertise of the person performing the treatment. Is AccuTite worth it? Well, that's a personal decision, but for a frame of reference, we usually say that with these radiofrequency skin tightening procedures, you can expect to achieve about 30 to 40% of the result that you might achieve with a true excisional surgery, like a facelift or a neck lift. These radiofrequency-based procedures are significantly less expensive and have significantly less downtime. So it's really a matter of trying to decide where you are and what you feel comfortable with, both in terms of your finances and how that downtime fits in with your life, and balancing this with the magnitude of the change that you're hoping to see from a radiofrequency-based skin tightening procedure like AccuTite versus what you might see with a true excisional surgery like a facelift or a neck lift. For a busy professional who wants to see a real change in their appearance, but not something quite of the magnitude of a facelift or an excisional blepharoplasty, and who doesn't want the downtime of those procedures, a skin tightening procedure with AccuTite can be a great way to go. Thanks for listening, and don't forget to subscribe, share the show, and head over to DarrenSmithMD.com for more real-world plastic surgery talk.